Hi, this is Dr. Jonathan Bayuk. I'm an allergist and immunologist in Massachusetts, and I wanted to give you a brief update on some breathing techniques and some other things that can be very helpful during the coronavirus COVID-19 pandemic. So the first thing is, and I want to make sure that I'm very clear on this, is that we have to keep going. We have done a very good job of flattening the curve. We're somewhere around halfway through this, but we gotta keep doing it. And I know that there are states that are starting to open up, but we have to stay away from each other as much as possible with social distancing. We have to wash our hands and we have to not touch our faces. The other piece that I need to share with you guys is some other breathing techniques. And below me on the screen should be some links to a previous video about breathing, which I'm going to talk about right now briefly. So one technique that patients who have been infected with COVID have said has helped them is the following. So you take a deep breath in, you hold it for 5 seconds, like this, and then breathe out, repeat that 5 times, and at the end of it, give a really strong cough so you can open up your lungs. And that's been shown to be very helpful, at least with a lot of patients who have shared that with me. The other piece that is really important is if you do get sick, you gotta move. So this disease makes people very tired and weak, and you gotta get up and move around as much as you can within reason. So that's really important. So we all wanna lay down, we wanna lay on our backs, we all wanna lay on our sides, and we just can't do that. It's just not the right thing to do. So get up and move. New piece of information is a local hospital has done very well keeping patients with COVID off of ventilators. And one of the ways that they're doing that is by putting them prone or on their stomach. So when you're laying down and when you're sleeping, you gotta spend some time laying on your stomach, because our lungs, when you're quiet, they'll collapse on themselves. And when that happens, which is called atelectasis, the virus can go crazy inside your lungs and cause a lot more damage. So you gotta make sure you spend some time doing that. The other piece that's been very helpful for people who have been sick is to stay hydrated. Viruses don't do as well when you're hydrated, so you gotta make sure that you drink enough water or Gatorade or ginger ale and those types of things to make sure that your body has enough fluid so it can fight the infection. So to reiterate, we gotta do 4 things, okay? You gotta breathe, practice those techniques. You can do it before you get sick. If you do get sick, you gotta move as much as you can. You gotta lay on your stomach if you do get sick so you can aerate the back parts of your lung. And the 4th thing is you gotta stay hydrated. Look, we're doing a good job. We're getting through it. We're somewhere around halfway through this whole process, but we gotta maintain the social distancing. We gotta make sure we wash our hands and don't touch our face. If we do that, we will get through this. We will get through this regardless, but we will get through this quicker if we do all those things. I hope this helps. Be safe, stay well, wash your hands, and don't touch your face.